How do you know if a vascular specialist has advanced skills? I'm Dr. Bradley Hill, vascular surgeon with Hill Vascular and Vein Center in Campbell, California, with this week's medical notepad. If you have peripheral arterial disease, or PAD, which is plaque buildup in mainly the leg arteries that restricts blood flow, you want to make sure that your vascular specialist has advanced skills. PAD specialists include vascular surgeons like myself, interventional cardiologists, and interventional radiologists. Title doesn't matter as much as skill set. With PAD, you need to ask critical questions that help you better understand the extent to which a physician will exhaust all efforts to prevent amputation. These questions will help you understand if a vascular specialist offers advanced tools and techniques and with a greater success in limb salvage. Ask, do you use intravascular ultrasound, known as IVUS, for additional imaging for sizing and placing balloons and stents during an angiogram procedure? Do you use multiple approaches during the angiogram? This means if the physician can't get through a blockage by going through the groin area, they have the skill set to approach the blockage from below by accessing an artery in the foot or the calf. Do you treat the arteries below the knee and in the foot using minimally invasive tools and techniques to prevent wounds from developing on my foot? Do you use reduced trauma techniques to decrease the need for placing stents? And if you've exhausted all advanced minimally invasive techniques to open my blocked vessels, do you have the ability or have a relationship with someone who has the ability to perform bypass surgery, endarterectomy, or hybrid approaches to restoring blood flow? This is critical because these methods can be more durable than some minimally invasive methods for patients with recurrent or extensive blockages. One more advanced skill vascular specialists are starting to adopt is known as deep vein arterialization, or DVA, where they reroute flow from an artery in the leg to a vein in the leg or foot. You can ask about their experience in performing a DVA, and it does indicate the doctor is on the cutting edge. But I wouldn't eliminate a physician who doesn't have this skill unless you are facing imminent amputation and it's medically indicated as a last resort for limb salvage. Of course, along with the aforementioned questions on specific advanced skills, you also want to ask the vascular specialist to share their success rate in saving limbs in cases like yours, and how they mitigate risks involved with any procedure they might perform on you. Ultimately, the end goal is to optimize your quality of life, and the treatment plan must be tailored specifically for you. With this week's medical notepad, I'm Dr. Bradley Hill, vascular surgeon with Hill Vascular and Vein Center in Campbell, California.